Hello to everybody. It is a pleasure to join you and just give a head start to our webinar. Just a few minutes to just talk about Hacking Health. Hacking Health is a worldwide network. It started a few years back and has spread all around the planet, with about more than 70 chapters in 5 continents, and Athens is one of them. We are organizing our first hackathon 8, 9, and 10 February in the Athens Innovation Center Chamber of Commerce in the center of Athens, and we chose a very contemporary subject. I will tell you how it started. Hacking Health started from eHealth Forum. eHealth Forum is a group of people who love innovation in health. We have organized a few years back eHealth Forum events. Last year, 2017 was the last one. And we also organized different meetups. So eHealth Forum joined forces with BioMPP, another group of innovators in Greece. And the first goal is to make different stakeholders work together to solve healthcare issues. Now, through innovation. And then we discussed and said, what sort of issues can we solve? And we thought that in Greece, it's very common now to talk about health record. But the national health record is an issue only for Greeks. And then we said, why not discuss then something wider? Why not use the International Patient Summary? International Patient Summary has been in our discussion for a few years, and it has an interest beyond Greece. And then we discussed with Katerina Chronaki and with a bunch of other people who are, organizers in this event. And here we are with a webinar to talk about tools. So what we want to achieve through Hacking Health, we want to team up different stakeholders, form a community, and start working together to find solutions for different urgent or less urgent issues in healthcare. What we know from literature and from experience is that all stakeholders can build up solutions on their own, but most of the times those solutions do not meet the needs of other stakeholders. And the only way to solve issues is with interdisciplinary teams. And the hackathon is a very good tool just to do that. And here we are. So we have the 8th to 10, it's a weekend plus a meeting where on Friday we're going to have discussions and pitches. Saturday till Sunday noon we're going to work in teams, and then in the afternoon we're going to have our jury to decide which team has come up with a good solution. And very shortly we're going to announce prizes. We make a huge effort to have financial prizes involved, and we will know later this week about the prizes. But we also have mentoring, and HL7 which is the incubator of the Athens Chamber of Commerce, will provide mentoring up to 6 months for the winning teams, or even for teams who will be runner-ups. So that's really what I want to tell you about. We will post this small presentation, but it will be good for you to just join our website and see all the things that are announced. One other thing I want to talk about is Sparkboard. Well, Sparkboard, let me check whether I can see Sparkboard. Just a minute, sorry about that. I may have to come, oops. I don't know, sorry about that. I'm not very good in that. Where is it? Well, I have to just come back later to talk about. I will just tell you about Sparkboard. Sparkboard is a place where we can post our ideas and make teams to work together. It's a tool from Hacking Health, and you can find all information on the web page. You sign in. It's a different. You have to sign in separately from the hackathon, and you can post your idea or your prototype if you want to, and ask people to join you to solve the solutions. But I may come back later in this webinar.
What I would like to talk about, uh, I would like to talk about the Trillium 2 project, the international patient summary tool, and in that to give a very short introduction to the FHIR for people that doesn't know the standard, and the how to use the FHIR IPS specification. So the Trillium 2 project, sorry, I tried to see how to make more clear the screen. The Trillium 2 project is built on is a European funded project that is built on the EU-US Memorandum of Understanding, and it support the development of innovative collaborative community around the concept of patient summary, trying to leverage on the international interoperability, the development of workforce, and the creation of innovation ecosystem. This project built on the experience coming from the EPSOS project, and then on the following Trillium Bridge project that try to exercise and evaluate the exchange of patient summary not only across Europe as the EPSOS project did, but across between US and the EU. One of the main results of that project was the identification of a need for the standardization, a need for the also for the global ecosystem for the interoperability, the need of advance on an international patient summary to enable people to access and share health information for emergency and planned care. So based on this, the Trillium 2 project start on working on the International Patient Summary Standard. Meanwhile, SAN and HL7 start on developing standard for that International Patient Summary, and the Trillium 2 try to highlight the social value of the patient summary, to contribute to the governance, to develop learning resources, so that if you go to the Trillium 2 side, you can access learning resources about the International Patient Summary, foster innovation, and other objectives. The International Patient Summary, we will spend some time on that later on, but you can always see the patient summary as a way to access, to have a snapshot of the health information, as first access to the health information of the patient, and entry point to know something about that patient, about health and related information. So this is a very, very brief overview of the Trillium 2 project, but you can really learn more, about that to the Trillium 2 site, or asking to the scientific coordinator or to the administrative coordinator. Let's go more in deep about the core topic of this meeting, that is the International Patient Summary. Any one of us has a rough idea of what a patient summary is. A patient summary is an extract of a health record that provides a snapshot about the patient. But there are different ways to conceive this concept. The International Patient Summary try to emphasize the need of having a generic solution for global application that goes beyond a specific application in a country or region. And in doing that, also focus a little bit the content and the scope of this kind of document. As mentioned before, HL7 and SEN started cooperating in the development set of standards. So an agreement was signed between the two organizations to cooperate on a single patient summary concept. And 4 different standard, and I hope you are able to see the screen. 4 different standard has been developed, 2 by SEN. The first one is the SEN 7269, that is the defined data set, means the data model, the list of information that you may find, the core set of data in the International Patient Summary, and 2 implementation guide, one based on the HL7 CDA standard, and the second one based on the HL7 FHIR standard. What we will focus on the second one. Recently, we may say that an additional artifact is added to this family. Is this NOMED IPS free set is not yet fully available, but will be by the middle of this year. And this allows to use for free a set of concepts for the scope of the International Patient Summary. These through the contribution of SNOMED International, also for the countries that are not member of this organization. So the 2 SEN standards, for all the 4 standards, the ballot pass means that are quite ready to be published. The CDA implementation guide is being already published. The FHIR will be published very soon, but in any case, the content is already accessible. The IPS is the one of the example of best practice of cooperation between the 2 organizations. And the International Patient Summary has a set of properties. It's minimal, non-exhaustive, is implementable, applicable. What does it mean? Just to provide some short information about what you can expect. Minimal means that International Patient Summary is a summary. So it provides a core set of data that all healthcare professionals can use. And the idea is that is not conceived to fulfill any possible purpose, but is a common set of data that could be used across different scope. So implicitly, it could be extended, as we will see better later on, in order to be used in different contexts. As told, is a special diagnostic condition independent, means that is a starter set that could be used independently of the context of use, and this is the characteristic. It's clear that a patient summary, when applied, is applied for a specific condition, but is not designed to support a specific condition of the patient. And other characteristic is that need to be implementable. So the standard is being designed in order to support this attribute, is applicable for global use, is open extensible, means that as told is a core set, but it could be extended to support additional stuff, and a sustainable maintenance process has been established in order to make the standard sustainable. So in its first interaction, the IPS has been focused on the unscheduled cross-border care, and this is the scope for which has been designed. But it provides a baseline in order to be used also for scheduled and unscheduled care. What does it mean? That it means that you can use this core set of data to create, to support use case that goes beyond the unscheduled care or the emergency. So you will have a set of building blocks that you can try to reuse for the scope that you have in mind, but it's a common set that is common across different different contexts. So the IPS allow a progressive approach. It means that you may have very core information, essential information, that is those shown, for example, in emergency context, that provide you a rough idea of the content, but you can have additional optional information there that allow you to go more in deep and to learn more about that patient if you need to. However, the IPS is not an electronic care record. Doesn't means that it did not cover all the possible information about the patient. And the Trillium 2 tried to extend the IPS concept beyond this initial scope of the IPS, analyzing additional cases like the chronicity, child health, frailty, vaccination, and more that you can maybe think about it. So I hope that also during the hacking health, you may have some idea on how you can reuse this block, this building block, this information data model for the scope that, for the scenario that you have in mind, you would like to realize. So the IPS born as a document, but you can always see this as a sort of library of information for allergy, problem, result, medication that you can reuse and combine in order to support additional case. This is reported an example, the vaccination card or European card for vaccination that could be designed starting from the vaccination part and maybe adding some additional information that you may consider useful for that. So this is a very high-level summary of the type of content you may find in a Trillium, in an IPS document, or the building blocks that are part of the document. You have medication, allergies, and problem. You may have as recommended information to be included immunization procedure, medical device, and results, any kind of result, lab, imaging, or other results. And optionally, you may report vital sign, information about the functional status, plan of care, advanced directive, information about pregnancy, social history. What we experience in Trillium 2 and we have added in the as additional section is the encounter section in order to report possible encounter that has been that has this patient as a subject. But other have been considered as well, like a risk assessment or family history, and so you can think about other that you may consider for your purposes. So this was the overall description of the IPS. Since the idea is to work on the FHIR, and I don't know if all of you has some experience on that, I will try to give some very quick overview on that standard. The intention is not that of giving a full representation, a full course of the standard, but just to try to give some information where you can find the information, and just to facilitate a first approach in the first approach to this. Sorry, I'm trying to see if I'm able to send the presentation on that screen. Okay, now it's better. So this short presentation will be based on the standard course made by Ruth Kramer. What is FHIR? FHIR is a new, I don't know if defined new now, because the first release 4 is being published right now. That stands for Fast Cell Care Interoperability Resource. The main idea of FHIR is to take advantage of the new web technology and of the REST architecture. So the basic concept of FHIR is the use of resource. A resource is a local unit of an atomic unit of information that is well identified and it has a well-defined meaning and behavior. For people that knows other kind of standard, it's like the segment in V2 could remind, is not exactly, but could remind, or CMAT in V3, or the information entity in DICOM. So it is built on the concept of 80-20 rule. What does it mean? Very roughly, it means that it do not pretend to cover any possible solution, but it tries to include the main information about the patient, about an encounter, about the condition, and leaving to extension the information that have not been included in the resource. Any resource has a specific identifier. Usually is the endpoint where you can retrieve the resource itself, with a type of resource and a logic identifier. The FHIR resources are listed in the FHIR specification, and let's go. Maybe it's easier, maybe to browse directly the FHIR resource. Sorry. Okay, so you can have the FHIR. You see, what I would like to show you is how the FHIR specification are very well specified, easy to browse. So you don't need me to start reading and using FHIR respect to other specifications. And you can click, if you click on resource, you go in build.phir.org. You have the very last build of this specification. You can do on your own now if you want. You have a list of the different resources, and for each resource, what you can find is an introduction. You may find the content. You see that, for example, a patient has an identifier, an active, and all the information. If you want to know, for example, what is the data type of the identifier, you have identifier, you click there, and automatically you arrive to the, we need to wait for loading, and you go there and you see directly how the data type looks like and all the information. And all the information are linked and browsable. So the idea for FHIR is that of, let's try to come back to the presentation. So HL7.org.FHIR is the link, or build.fhir.org. One important concept in FHIR is that if you have the different standard, if you have the different standard resource, maybe you could not be able to create what you would like to realize. For example, because there are missing information that are not in the base standard, in the base resource. The way to do that is to use, as I told before, the extension. And the extension appear, for example, if I would like to have the patient mother name in the patient that is not part of the standard, or the citizenship or other information like that, you have this extension with the identifier of the extension and the value. The FHIR concept is to work on the idea of resources installed, and the resources are a combination, mean that each resource refer and use other resources, and combining them, you describe the information that you need. For example, if you go to the diagnostic report, you may have a subject that is a patient, and the patient is another type of resource, or the performers that could be a practitioner or practitioner role, or negotiation, or the result that could be an observation. And you have in the resource all these references to the other resource, and the reference could be realized in different ways. These are two examples how the reference to a patient, for example, patient F001, is realized. Obviously, there are complex and simple data type. You go directly. Let me see if I'm able to go directly here. You have here the data type, and you have all the different type, and clicking on that, you have the list of how, for example, the ratio is, and so on. So, as I told before, FHIR is quite simple to browse, and so if you have question, you go to the specification. Are almost real clear and quite easy to use. As I told, we have complex data type, and that are a combination of complex and simple data type, like string or name. And you have, I would like to point out a specific type of data type. This is the codable concept that's allowed to provide code information, and information code usually provided using a system, a code system, in this case ICD-10, and the code itself. With respect to the V3, for people that used to use CDA, for example, the codable is not just a coded concept, is a codable concept. So you have the coding part, but you may also provide this as a piece of text if you are not able to provide the coding. Another important thing that could help you if you are looking is the choice property. Sometimes you see information like this one, like value and a series of different type of value, like quantity and so on. That means that the value might be any of this one. In this case, please remind that when you implement, the element is not value, but it will assume the name of value quantity or value string. So is it the physical name in the implementation will be the combination of the name of the element plus the data type. So just to quick how we can access this information. This resource could be accessed mainly using REST call, so that you can, for example, post into a FHIR server to create in a FHIR server patient or an order, or you can then retrieve this reading or querying this with a GET, or you can create a new lab result reusing this information retrieved, and you can, for example, update using the put some patient information and obtain new lab result or query for new lab results. So the way the resources are accessed, usually you have the endpoint, the name of the server, the endpoint, the name of the right patient, or could be condition or other, and if it is a direct read, you have the logical ID. You may specify the format. It could be JSON, could be XML, usually these two. And as I told before, there are other possible and more specific operation, but if you think in terms of REST, so the create is realized using the post operation, the read and the query using the get, the update using the put, and the delete using the delete. You may have a version-specific read. You may have query search that you may realize this is a kind of read in any case. And this is the way you interact using REST interface with the system. Just to introduce a very another concept that might be useful for your purpose is the bundle. Resource could be grouped into bundle for specific operation. For example, if you make a search and you want to have in a query, you have returned more than one order or more than one patient, the information returned is not a single resource, but it would be a bundle of a specific type, a search set bundle that includes, for example, all the order information, or you may use the bundle to submit a batch or a group of data with a specific operation. So that different type of bundle could be a document, like the IPS bundle. You may have transaction batch, means that you have a bundle that you can use to ask the server to make a set of atomic action. In the transaction, if one of the action fail, all the transaction fail. In the batch, each action is processed in a single way. So if it fail, only that action fail. And the other one is the search set. Any result of a query search could be a search set bundle. Without going too in deep, because there are a lot of things to say in very short time, just to you can search and you can play on the search. Usually the search is a get operation. For example, you can ask to all the operation if you ask for patient, or you can filter using specific parameter. What you need to know is that if a resource has a set of attribute, you are allowed to perform the query only a specific set of attributes that is defined in the standard. I show you where this information is. If you go to the resource and you take a resource like practitioner, at the very end of the first page, you will find the search parameter. Means that you are able to query the practitioner resource using a specific set of attribute: active, address, city, And the type of query depends on the data type. So for the string, you are allowed to perform specific type of search, for token, other kind of search, and so on and so forth. I don't want to go too much in detail on this. What you need to know is that if you go in documentation and you go search or REST API, you may find all the different detail about how to perform query, what are the modifier, what are the so it's very, very complex. You can perform very complex query, and you can find here in documentation share all you need about that. Just to see, let me see what is maybe important to mention. Let me move very quickly on the other type. Okay, is the FHIR document maybe interested in? A document in FHIR is a type of bundle with a specific type of resource on top of this. That is the composition. The composition includes a sort of contextual information like the header in the CDA and a series of sections that refer different type of resources. This is the example, for example, of the IPS composition. So you have here the type of information in bold, those that are required for this profile. You see here the typical section that you have in the IPS composition: medication, allergy problem, immunization, and so on. And for each section, you have a title, a code, a title of the section, and a list of possible entry. Could be required entry, could be optional, and each entry refers a specific type or more than one specific type of resource. So to conclude that part, and then I will go back to the tool specific of the IPS project. The good thing is that this resource, this building block, could be reused independently of the type of paradigm that you are using. For example, you may have lab systems that interact using FHIR messaging, or you may have system that query using a REST operation, or you can consolidate a set of information into a document. The thing is that all of these paradigms will use the same building block that are the resource. So, and these are the core part of the FHIR. So let me now go directly to the last part, and then I will leave you some time in case for the question. So let's start. Let's see. Okay, so the HL7 FHIR IPS. The HL7 FHIR IPS, we are referring to this standard, in the family of the IPS. You can find information about the data set in RDecor at this link. So if you are interested to know, for example, what are the type of information independently on the way you are implementing in FHIR or in CDA or whatever you want, you have the SEN standard that describe this. And let's see if I'm able to show you. Let's see. Okay, not yet there. Okay, if you go in that link and you will find it, you see that you have different group of information like allergy or immunization, and for each of it you see what are the type of data information that you expect to find. Like for immunization, you expect to see at least the type of vaccine, the date of immunization, the product that's being administered, and some information about the process. for the allergy, without information about allergy. So you have here a very high-level representation of the type of information that define the core set of data that represent that specific resource. Having said that, you have a similar thing also developed for the Trillium 2 dataset. So you will find a link here. I will not show you in detail because it's similar. So these are the two implementation independent structure of the IPS according to different. You will find in the Trillium 2, for example, external references and encounter also defined. And then this is the main reference for the FHIR IPS. So if you go to the link here, build.fhir.org IG HL7 is this link, build HL7 FHIR and so on. You will find the implementation guide. So you have an introduction. I don't want to describe what is the IPS as well, the general principle of design. But what you might be interested in is the profile. So you have the list of profiles that are used in the IPS. And for example, if you would like to know how an allergy is specified in the IPS, you can click in the allergy and you will find a similar structure as you have seen in the as you have seen for the resource. And so you see that, for example, a specific extension has been defined for the allergy intolerance, that you have the clinical verification status, and those are the elements that are supposed to be supported for the allergy part. And then you have the complete resource. This is what is called the differential view. So the difference with respect to the standard resource, and this in the differential, this section you see the data. And also in that case, you can, if you have doubt about what does it mean daytime or how a codable concept U data type is realized, you can just click there and the system point you directly to the FHIR specification or to the where this part of the information is being. And so is also the specification is completely browsable. And this standard describes either the IPS as a document or the single data block. So the composition, the condition, the allergy, all the data block that might be useful. So this is the main reference to see what are the information, how to implement the different block. Trillium 2 as well specified, since it tried to understand, tried to exercise how to extend the usage of the IPS beyond the specific unscheduled care use case. Trillium 2 also include additional, let's say, extension or add-on to the IPS. So the profile for the Trillium 2, this is based on the STU release 3, are available in the Trillium 2 GitHub site. So this is the link, and the GitHub site you will find you have the profile under the profile folder, the value set used in the value set, and some example. And we'll spend some more time maybe in the example later on, because maybe you can try to hack them in order to create your own scenarios. So you can access this GitHub and to download the resource that you need for the IPS as well. If you would like, however, some of the resource has been also uploaded in Simplifier. So Simplifier is a registry for provide is a repository for FHIR resources and example. And if you go to simplifier.net/Trillium2, you may, for example, have a graphical representation of the profile that has been defined. For example, if you click in the immunization profile for Trillium2, you have a representation similar to that shown. In GitHub, obviously, you access the profile definition. So you have the XML file that define the FHIR profile. But if you want to browse and to have an interface and see what is the content and what you expect to find there, you can go to the simplifier and to browse the different information, see for the patient or for the immunization or for the different type of information, how they look like, if you are not interested in analyzing directly the XML file. For example, if you go to the profile and you select the, for example, the composition, you see here you have the composition that specify the international patient summary, but also the encounter report. So, and this, sorry, we need to wait for loading. It takes some time because it's a little more complex as structure. Okay, and you see you have here the composition. Let's try to zoom a little bit, hoping that you are able to see. You have here the section, and you see here, I hope you are able to see that you have medication, allergy problem, and plan of care, encounter, admission medication, discharge medication, and so on. And when you click here, for example, medical device, you have here the direct reference to the profile that specify a device statement, and the same for the other resource. So you can browse and click and move directly from the different profile, even if the most upgraded profile are those that are in GitHub. So what else about the information? This is what I showed before, how it looks like an IPS composition. So you have the header part, the list of the section, and then the section detail plus the entry. And for each entry, you have the profile that define, in that case, the condition and the information that specify the single entry. This is how the IPS composition looks like, and you can find here a specific example that has been loaded in one of the Trillium2 testing resources. This was prepared for the Datathon in MIE 2018. And the returning the document, it, as described before, is a specific type of bundle of type document that include the composition of first resource inside the document. Let's try to conclude mainly with the list of possible server. So Trillium2 set up 2 different servers, and maybe later Alexander could give some more detail about that. One is the GNOMON server that has been used, for example, in the disaster management exercise, and the other one is the SRDC testing server. However, if you would like to There are some other FHIR resource, FHIR server, and if you like to test IPS based on the IPS specification release 4, FHIR release 4, you may use, for example, this test FHIR server for your trial. So to conclude, these are the link to the sorry, let's go directly here. For example, I show you GitHub just to help you on browsing the system. Sorry, okay. So you have here Trillium 2 repository. If you can get up, and you have example, and you have here in UMFH, you have the list of all the example created for the disaster management. So you see is a long list, including also an encounter report. And if you click on each of them, you may see the list of the single resource that has been used to create the IPS bundle. And you have also example of bundle to be stored in the normal server or in the SRDC server. And so if you are interested in looking how the condition or medication or a patient resource looks like, you can go there and click and see. For example, here you have a patient with an extension include the citizenship, an identifier, a business identifier, the name, the gender, the birth name. And you can have the other example as well. The nice thing of FHIR specification is that for each resource, you find in the specs also a large list of examples, so they will help the implementation. For the other example, you have beside the UF disaster management part some example related to the imaging observation with also external references, more simple and complex imaging result observation. Some example for asthmatic patient. This is tested in MIE and other. And I hope that after the hackathon, we can include also your example here in order to increase the number of resources for the support and implementation of the IPS. So, okay, quite on time, but I don't know if you would like to collect all the questions at the end, and in that case, I will pass the floor to Alexander to conclude.
So let me present in a very few slides what an example could look like in using what Giorgio described, and I will try to refer a little bit to what we have done as my role in Gromon Informatics and participating also in Trillium 2, creating some examples, and one example that we created and we intend to use as well in the Hacking Hell hackathon in Athens is the idea of the disaster management scenario. So it's one of the basic scenarios that reuse basic components of the IPS for emergency situation, which is a very classical reuse of the patient's summary information. So let me go to the next slide. So try to describe a little bit what is a disaster management scenario. The idea is that we have some large disaster, which unfortunately it occurs more and more every time. And a lot of organization is needed in order to be able to better support the patients in such situations. One of the importance in real life is the possibility to have background information of the patient, so patient summaries or history of the patient, so that more adequate emergency treatment can be provided on site. So that means that doctors in practice, they don't have a lot of time to review detailed electronic healthcare records. They don't really care, to be honest. What they really want is 4, 5, 6 very basic information they really need so that they can provide care to a person that is in real need. So in that sense, the patient summary is really adequate for this case. And the very basic scenario we try to create is an idea where there is a field hospital somewhere, so a basic installation created for emergency situations that tries to see and collect patient summary informations. For example, some patient could have some type of their own application, which they could store the patient summary on their mobile. And if you see what's happening, there are several already even phone builders that are proposing similar situation to the patient summary. So such information probably already resides in some phones of a lot of people. So taking a lot of disclaimers and about security, data privacy and all this, the basic idea of this scenario has more or less 3 parts. One part is the patient himself, who has some type of information, for example, eHealth Pass, which is provided by Gnomon, but it could be something else. That has some basic information, and it's linked obviously to a repository, which in that case plays the role of the FHIR server, where his information is stored and organized, and he has control over that information. And the other actor is the some type of local information system. So it can be something very complex as an hospital information system, or it can be even something very simple, something that can be built to log information in such a disaster case. So as you see, in such a scenario, you don't reuse all the components that a patient summary or the extensions of the patient summary can handle, but usually you need very, very few information that makes sense, mostly allergies or recent active problems. If you have some type of existing chronic disease and you probably take some existing medication, and what type of medication you think the patient is already taking. This is usually the basic information that you need in order to not create more problems than resolving. So take into this account, the idea is reusing all what the wonderful things that Georgios sent, the examples, the resources and everything. You can create very easily pieces of code to have this information. So you don't really have to implement this from scratch. You just have to go back in the FHIR resources and select what you need and try to, as Lego blocks, to reuse it in the scenario that you want to create. Those are just examples of the construction of several parts of what can be used and what we have reused in our case. So it doesn't really make sense to explain in details here. It's just an example that things can be built in a very, very efficient way and not taking too much time. So concerning the FHIR server, we have, especially for the Trillium project, and also we can reuse it in the Hacking Health event in Athens. We can reuse the FHIR server from Gnomon, which has been created for testing purposes. And in that basic scenario, there are 2 more or less basic, let's say, functions that we can do and try to collaborate with other participants in the event. One is to receive encounter reports, so what happened on a patient as an encounter during the treatment. So there is a specific here that a piece of code that can be used to send to our FHIR server a set of FHIR resource based on the resources as described by Giorgio. Or even simpler, just to request some sections of an IPS, and you can have access through this get function to our FHIR server to ask for some information so that you can visualize in another application, for example. So this is more or less how this retrieved IPS would look like in our application, but in another application it could look like in a different way. It doesn't mean that our proposal is the best. Obviously, following the different standards we are proposing to reuse a structure that has been also used by the European Commission in a cross-border healthcare setting. So it's quite compliant with that view. Here is the list of resources that you can use in implementing this disaster management scenario. As you see, it's reusing the different links in specific parts that Giorgio mentioned before about the FHIR resources. They are examples on Simplifier, as Giorgio explained, and some counter reports resources that you could use if you want to send back information to the FHIR server, and as well some test patients that you can use to create if you don't want to recreate patient data, test patient data from zero. So more or less 80 to 90% of what someone would need to make an example could be used through these resources. So in this sense, in the scenario I described, we can cover two of the three actors, meaning the patient that would probably use our application, and we could visualize patient summary information that we receive, from example, from a hospital information system or another personal health record or electronic health record that could send us this type of information. And we can also provide the FHIR server for this communication. So that's more or less in a nutshell what we propose. And this is what we are going to also describe in the Hacking Health Spark Ball as our contribution to the event. So Giorgio, I think we made the first round. I don't know if there are questions to any of us.
The only question that I see, are you going to send us the PowerPoint?
Yes, of course.
Yes, so we'll do. And other questions? Let me see. You can write. I will enable the voice for all of you, so you are entitled to unlock your microphone and to speak and make questions. If not for the time being, I will give the floor back to Lila for conclusion.
Hi.
Okay, let me unmute the other one. Okay, I hear, okay, some noise. Okay, please, Lila.
Yes.
Yes.
Yes, hello. Well, what I would like to say is for people to just go and see the web page and do the registration. If any of them have difficulties in paying the 30 euros registration fee, let them contact us and ask for a grant. Probably some of our sponsors would be willing to cover that. And the other thing is that whatever information is going to be uploaded on the web page, if they, we're a small community, if anybody needs any information, just contact us. That's the whole thing. And we are going to upload all this information from the webinar on the Hacking Health Athens webpage. And we welcome you to come back to us whenever you need it's necessary. Thank you very much. I mean, it was excellent. It was technical, but at the same time, it gave us a lot of information about repositories, about how we to use the tools, and people can have some to do some thinking and see what will be the ideas that will be put forward for solutions during the hackathon. Is Katerina, would Katerina like to add a few words? Hello?
Yes, maybe she is not able. I don't know if. Okay, let's see. Okay, otherwise, I really wish you to see all of you in Athens shortly. And
Yes, of course, absolutely.
we can continue. I recognize that we gave a lot of information, but as I introduced, the idea was not to give some hint and to give the possibility to look of the resources that are available in the different site. And I hope during the hackathon we can discuss and to work together in order to make this happen. And if you have questions, I will be there. I will be happy to answer your question about FHIR and the IPS.
Excellent.
So I see there is some additional question. Let's see. Okay, no, so only thank you. Okay, so if there are no other questions, or I don't see anyone in the chat. Oh, let's see. Sorry. Yes, there are. Let me see how I can. I'm very sorry, just to understand how to read correctly, because the size is very different question. It's necessary to use the Trillium tools. Are we supposed to implement a functional prototype application or a mockup? I can answer to, or mockup would be sufficient. I can answer the first part, and I'll leave to Lida and Alexander the second part. There are, I mean that there are tools. You may refer to the Trillium resource. You may refer to the IPS resource as well. So as you prefer. You can. It's an opportunity to use the existing Trillium 2 resources, but you may refer to the general IPS stuff if you prefer to. And for the second part of the question, are we supposed to implement a functional prototype or mockup is sufficient? I'll leave the floor to Lida and Alexander.
I'll tell you what, if we have a very good idea that it's not, and we did not have the time to come up with something finished, and the jury says that we will give them time and come back in a month. So the actual, we need to have something like a prototype, but the jury may decide that a mock-up is enough if it is backed up with good, if the idea is very good and is thought to have a great potential.
Okay, the other question is now the following. How can someone become a team member? Are there already created team? Can we see somehow the challenges?
Well, if you visit the webpage, you can see the challenges. What we have as program is that we have some talks on Friday evening, and then we will have the pitches. which means that people will come up either because they're patients with a problem and an idea, or health professionals, or developers. And they will present in quick pitches their ideas and then ask people to join them. We have a Spark board to just put up your idea so that people will know beforehand and team up. But from previous experience, we know, and because this is our first hackathon, that people may not use it. And they will prefer the traditional way to come there and come up and within 2 minutes present their ideas and make up a team. Usually Saturday morning, it will take about an hour or two to team up and make a good functional team that will work for the rest of the time.
Okay, there are another question is, what about patient consent? I can give you the consent is not specified in the IPS per se. However, there is a FHIR resource called consent that can be used to record and exchange consent information. The question is, do we have to create a new challenge?
The answer is that you can play with different facets of challenges, which means that if you come up with a very good idea which is related to the International Patient Summary, yes, you can present it, and if there are people interested, they can join you. Yes, we are open.
Thank you. Then there is a initial part of a question that say, in the disaster scenario, and then stop. I don't know if the requester would like to expand or... Okay,
Sorry?
waiting for that. I will describe the last question after this. Okay. Which coding classification will be used? Besides specific for the IPS, beside very specific field in which the specification required the usage of specific value set, and you can find them directly in the IPS specs. In general, there are preferred value set, means that describe what we expect to have in terms of code system, but other type of code system could be used as well. So you will find in the specs some constraint, but generally speaking, you are open to use different kind of coding scheme. And this seems to be the last question that we have in our list. So thank you so much again.
Thank you.
And
thank you all for joining.
Thanks. So see you all of you in Athens.
In Athens.
And thank you again. Thank you, Dina, thank Alexander as well.
Thank
and
you.
Catherine. Bye. Have a nice evening. Bye bye.
Bye bye.